So my study is about a subtype of melanoma. Melanoma is the deadliest type of skin cancer, and genetically, scientists have classified it into 3 distinct subtypes where mutations occur in specific genes. So BRAF mutant, NRAS mutant, or NF1 mutant. And my study focuses on NF1 mutant melanoma, which is an aggressive subtype. It's more aggressive than the other subtypes, yet it doesn't have any treatment available treatments available, unlike the other subtypes. So my study focused on really understanding if there are some mechanisms or some targets that we can go after that can help us, reduce the proliferation or treat this aggressive subtype. And unlike the other types of cancer, where a BRAF or an NRAS, there is an activation in these genes. NF1, it's a loss mutation, which means that NF1 is lost, and therefore you cannot target NF1. You need to look for other targets that you can target so that you can decrease the cell proliferation of NF1. So the study design is that over the past few years, we have collected and established some cell lines isolated from melanoma patients. These cell lines were grown in culture, and then we used these cell lines to do a comprehensive analysis, DNA sequencing, RNA sequencing, ATAC-seq, ChIP-seq, with the purpose of comparing the NF1 mutant to the NF1 wild type, and then doing some molecular studies and functional studies to test if these targets that we have identified are functionally can be targeted and can be meaningful if we target them in treating cancer, these NF1 mutant patients. Our main finding that we found that EGFR, which is epidermal growth factor receptor, is upregulated in NF1 mutant melanoma. Now, EGFR specifically is a target in many other cancers. However, it's not targeted in melanoma. And there are a lot of drugs that are already established that can inhibit EGFR. So this finding was primarily, we found that EGFR was overexpressed. We managed to validate this in other cohorts of melanoma, of NF1 mutant melanoma, and we also have shown that these cells, they depend on the EGFR signaling for them this signaling promotes cell proliferation and growth. And we also showed that when we knock down EGFR, these cells don't grow anymore; they die. And also, we showed that by inhibition using drugs available like Cetuximab, which is a monoclonal antibody that targets EGFR, can inhibit these cells in vitro, and they don't affect the NF1 wild type, meaning they are selectively targeting NF1 mutant melanoma. And then lastly, what we did is that we tested this in preclinical models, in vivo mouse models, and we found that both Cetuximab and afatinib, which is a small molecule inhibitor of EGFR, perturb the proliferation of the NF1 mutant melanoma. And so we think that it can have a clinical translation, our findings. We propose that we can target EGFR in a subtype of melanoma that previously there was no targeted therapy available for these patients. And I think that this is very important because if these patients failed immunotherapy, which is the standard of care for all other melanoma patients, then they are left with no options and they can progress. And melanoma is a very metastatic, aggressive disease that can lead to death within months. So I think that this can at least bring some hope in that there are targets that we can, or EGFR can be targeted in this NF1 mutant melanoma. And regarding the next steps, I think that our study actually, it does answer a question, but I think it raises more questions. How do we position targeting EGFR in other types of cancer? EGFR as a monotherapy, we know that it will help the patients for a specific amount of time, and then resistance will occur. It's quite often used with combination therapies with EGFR. So I think there is a lot of questions to ask, and that's what we're doing. We're trying to see what other drugs that we can combine with EGFR inhibition to be able to give these patients a more durable effect when we inhibit EGFR.